let's get up the Kahoots. Who's gonna win? Just to say, off the wall, total semester, I'm giving you questions on. I think Nikki's smiling. I think she's got it. So does Brianna. Dominique, you better just drive, okay? Turn off the camera. Just listen, all right? We'll do that later. I want safety. Remember,
Yes, ma'am.
safety first, whether it's children, protecting your students, safety. So, but I understand you got to do what you got to do. So let's go and let's start our Kahoots. Again, such a pleasure with all of you. I appreciate, all of the time and effort you put in. I mean, I put in a lot of work and I know all of you do too. So I want to thank you for that.
Professor,
Yes.
if you give me access, I'm trying to connect to my computer so I can use Kahoot on my phone.
Not a problem. Not a problem. Go ahead. Take 2 minutes, get her done.
Okay, thank you.
No, you're very welcome.
I do have one quick question.
Yes, ma'am.
So for the HESI, like the practice exam that was due on the 5th, I completely spaced on it. If I got it done now, what could I just get? Like half lowers credit, or
It's only 10% difference if you don't get it in. So do the best you can, because those are really important. Practice HESI assignment ones, they are really important to go over. Remember, to make you think.
Okay, thank you.
You're welcome. I think during this whole semester, I've made you guys think a little bit, how to take information and apply it in different ways. And, you're going into capstone, most of you, next semester. So I think I've prepared you so that you can take what's the diagnosis and what do I know about it and how do I apply it and what's priorities, et cetera. So I think you guys done very well.
Professor Bogart.
Yes, ma'am.
What the practice exam, isn't that due this week?
I believe, actually, I think you're right. Practice exam is due, yes, week 10.
Okay, just making sure. I thought I missed something.
There was another one due on the 5th, in the HESI case study, same website.
We have your A, B, and C's due this week. We have your Kaplans. Remember, I don't look at them until you do your A, B, and C. So I won't look at them till next week. So if you're late on the math, don't worry about it. I'm not dinging anybody for that. That's your freebie this semester. My present to you.
It was the pediatrics assignment exam.
Oh, you mean the project?
No.
The project, no. There's an assignment exam and a practice exam. They are both due. Practice was week 9, and then your assignment was earlier. Don't worry, I'll look at it. I'll accept it because it's not late to accept it right now in this week, okay? I'll look at it. I'll let you know, Lauren.
Okay, thank you.
Not a problem. All right, let's get going. HESI Review 2022, and remember, I take a lot of time making these up for you. What is probably the single most important influence on growth at all stages of development? If you don't know this answer, I'm going to come to you and beat you over the head with a baseball bat, because I think this is something I've said, at least 28 times, if not 28,000 times. Nutrition, 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 nutrition. If a child is not eating properly, not getting that nutrition, their minds don't grow. You're going to see delays in fine motor, gross motor, and you're going to see, it'll be very evident. And of course, height and weight, you're going to see that change too. Frequent developmental assessments are important for which reason? So we know that we're watching developmental assessments to see if a child is where they should be. And if they're not, what do? We're going to evaluate why, and we're going to make changes, maybe institute speech, physical, occupational therapy, because we want these children, they're so easy to learn, they catch up so quick. So we want to start it as quick as we can and catch these children up to where they should be. The head to tail growth of development is referred to as what? Head to tail. You roll your head first, you lift it up, you turn over, get on your knees, and you get up on your feet. That's head to tail. It's almost like gross motor. And it's called cephalocaudal. Cephalic is head, okay? That's how you remember it from now on. What is the single most important factor to consider when communicating with children? So when you're talking to a child, you need to know what developmental level they're on, get on that level, and then this child's going to work with you. If you don't, this child's going to take off and run down the hall and scream. And there's no reason for that as long as you get on their level, and they love it. What 2-year-old child pain assessment tool should the nurse use? You know, we've given you how many. I mean, numeric is adults for sure. They consider that 8 years and older in pediatric land. But what's that 2-year-old one? And it's FLAC. It doesn't change to faces till preschool, age 3, okay? And this is one of those trick questions. This is not uncommon for students to say faces instead of FLAC. It's still FLAC until they're preschool, 3 years old. What is priority treatment for a child with dehydration due to profuse vomiting? They're vomiting. What do you do? If they're vomiting, you don't want anything by mouth. It's IV fluids. Very good. The first expected fine motor developmental milestone for an infant begins with what? And these are fine fingers. Gross, G, get up and go, go, go. First thing is that reflex palmar. Put your finger in an infant's hand and they'll grasp it. And parents think, oh my goodness, he gave me a hug on my finger. It is a reflex, but I'll never tell the parents that because they think it is really sweet. An 8-month-old infant should be expected to perform which fine motor skill? Remember, fine, fingers, F. So by 8 months old, they should be able to voluntarily get a rattle, and they should use that crude pincer. It's not like that little fine little Cheerio pickup. It's more like the hand swishing it in their face, but that's absolutely what an 8-month should be able to do. In general, an infant should triple their birth weight at what month of age? So at 1 year old, 12 months, they should have tripled. If they're born at 7 pounds, they should be at 21 pounds. If they are 14 pounds or 30 pounds, intervention will take place for that, whether they need more food, higher calories, or less food. An RN is assessing a 2.5-year-old toddler should report which finding to the provider? What's wrong? Babies are born with big heads and smaller chests. By the time they get around 2-ish, they should have their head should be less than their chest or at least equal to. So if it's still bigger, something's going on. Hydrocephalus, brain tumor, something's not right. A 2-month-old infant with cradle cap, what should you tell the nurse, parents to treat it? How do you treat cradle cap? It's that white crusty stuff on their head. It's like dandruff, crazy dandruff. I mean, you can wash it with soap, you can put mineral oil on it, but it's that soft or that fine comb very gently. And during bath time every day, slowly you'll remove it. You can't scrub it because you have those nails up there, those soft spots, and we don't want to cause damage. According to Kohlberg, pre-conventional level of moral development, a preschooler who has moral reasoning does what? What is Kohlberg? What does he talk about? And I highly suggest you go back and you look at the different theorists, your Kohlberg, your Erikson, your Piaget. Those three you're going to see. So Kohlberg is children at the preschool age, ages 3 to 5. They know right and they know wrong. And they know that the right has a consequence and the wrong has a consequence. Which nursing action is appropriate to teach a preschooler child about a scheduled procedure? Let's say maybe a child needs to go in and get an MRI and they need to go in that machine. Well, use a doll. Maybe they need an IV. Show them where things are going to be. That doll will let them know exactly what's going on and they won't be afraid because they understand what's happening next. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? I mean, toddlers, ages 1 to 3. You can't just walk in the room and start listening to their chest and shining lights and doing that. No, let them touch the equipment. Let them tell them they're going to push the button on that blood pressure cuff. You know, if they're going to do anything, let the toddler be involved. You'd be surprised, 1-year-olds even understand. In terms of language and cognitive development, a 4-year-old should be expected to do what? 4-year-old, preschooler. Cognitive, they understand. You tell them to do something and they can do it. And that is following those simple commands. Put your shoes by the front door. Take your dirty laundry, put it in the hamper. These things they should be able to do. They should be able to understand. Parents are concerned their 8-month-old is not developing like their older child. What's the normal for 8 months? So at 8 months old, they should be able to sit unsupported, no pillows, no propping, not holding them. They should be able to sit 8 months old. Some milestone we look for. A multi-select. Which would alert the nurse to hold the digoxin on an infant she is caring for? Well, we know adults, we were taught that in pharmacology, but now we're talking about digoxin on an infant. What's different from adults to infants? And the difference is just the heart rate. We're still going to look at potassium levels. We're still going to look at digoxin levels. They're the same numbers, but the heart rate, we know normal heart rate for an infant is 140 to 160. If it's 90, there is a problem. If they're vomiting, it could be digitoxicity, and we should hold it to get a level. Very good. A 4-year-old is reluctant to take medication. What intervention should the nurse take? Probably my biggest thing with these poor children, they don't want to take it, they close their lips, they turn their head, or they start running, or they start crying. How are we going to do it? They need it. So when we have a 4-year-old, use that straightforward approach. And what does that mean? Well, you can have a pill and chew it, or you have a liquid. Which one do you want? Because you need to take it. When they make a choice, come in, here's your choice, go ahead and take it. When you are that straightforward, usually because they have no choice, it's better for them. And we know sometimes the liquid, if we take it and get it in their mouth, we blow quickly, very quickly, and a big puff, and it scares them and it causes them to swallow. We teach parents to do that. Which concept reinforces the development of a sense of trust for an infant? We're talking about Erickson here. What does trust mean for an infant? So that trust is they know that if they cry, somebody's coming. They know if they're hungry, they're going to be fed. If their diaper is dirty, it's going to be changed because it's done on a regular basis. So they can predict that. And that gives them comfort and decreases stress. An infant is NPO, unable to take breast or bottle for feeding. What is important to remember? There are many conditions that you can't feed children. But, infants still need to be able to progress developmentally. So what's something to remember to help that child still, progress? So they can't eat because, let's say they have a tracheoesophageal fistula. They feed, it goes right into their lungs. They can't eat, but they still need that stress reliever, that pacifier, that non-nutritive sucking. They do need that because that relieves stress for children. And we need to remember, even if they can't eat, they still need that. When teaching sex education and contraceptives for adolescents, what should the nurse consider? So when you're talking to adolescents, you can't put in your own opinion, but we can have oral and written information that we can give to them so they can make their own decisions. I mean, we want to tell them, no, you shouldn't, but adolescents are going to do what they want. So give them just information, accurate information, no opinions. The monthly immunization for RSV is, and it's given from fall to early spring. We give it to those children who are immunosuppressed, cardiac children, premature children. And it is called Synagis. Spelled it wrong, but that is the name. Synagis or palivizumab. It's one of those mAbs. It's like a chemo drug, right? An infant with hypoplastic left heart is becoming tachypnic, taking a long time to eat and requires rest. What assessment is priority? You see that happening in a child. What should you assess? What is going on? What do you think is happening? It's a cardiac child, a severe cardiac child. So probably going into congestive heart failure because these hypoplastic children or cyanotic heart disease, these children already have decreased oxygen intake because that is their, congenital defect. So if we fill it up with fluid, we're taking away space that can oxygenate. So we need to listen to those lungs to see, is it fluid that's occupying space that's causing them to even be more tired? And that would be my first assessment I would do. When doing an admission on an infant with a low-grade fever and a loose cough, what information is priority for placement? Which room in this, on our floor do I need to place this child? It's an infant, it's got a low-grade fever and a cough, but what's the next thing we need to ask to make sure they're placed in the correct room? And it's their immunizations. Are they up to date on their immunizations? Because it could be one of those diseases that we give immunizations for that prevent those diseases. So we need to know if immunizations are up to date. A 3-year-old is brought to the ER with increased wheezing for the last 2 days. The child uses a meter dose inhaler. Most important info to ask. They're wheezing. They've got one of those little inhalers. They're 3 years old. We want to know, did they really get the medicine? And we know that by that spacer. Did they use a spacer? Did they get that medicine like they should? Very good. A multi-select. What is included in the plan of care for a child with cystic fibrosis? We know cystic fibrosis has to do with the inability to take in some nutrients. It's the small intestines filled with mucus, and so is the lungs. So it's a two-part, diagnosis that we have to be concerned. Now, these children should be on a high protein diet. They don't absorb fat well. They also, because of all that mucus that clogs up the lungs, aggressive chest physical therapy. Also, they need those pancreatic enzymes to be able to digest food. Now, they're losing salt like crazy. Remember, if you licked that child, you would taste salt. So they're losing salt. So no, regular salt in their diet because they lose so much. Which information is most important when rheumatic fever is suspected? What are you going to ask the parent? You see, tired, fever, we're seeing that rash. We're suspecting rheumatoid rheumatic fever. Well, we can almost say it is that when we look at, did the child just have a strep infection? Did they just have a sore throat? Did you give all the medicine? Did you get it treated? So strep causes rheumatic fever. A multi-select. What are some assessments that an infant would have if they were in acute respiratory distress? What would you see? Your infant, acute respiratory distress. What would you see? You would see abdominal breathing, not diaphragmatic. You would see those they'd be flaring. And also, if I hear an infant that the end of a respiration goes, and that's what we consider a grunt, there is a problem. Respiratory rate of 34 is actually slightly low. Infants are 40 to 60, but grunting, nasal flaring, even if there's normal saturations, that is a problem. What is the purpose of giving indomethacin to a neonate with a patent ductus arteriosus? What is a patent ductus arteriosus? It's a connection between the aorta and the pulmonary artery. It is fetal circulation, and most of the time they close within 21 days after birth. Sometimes they don't. So when we give indomethacin, there is something called prostaglandin. It's a hormone that's normally produced by the mother that keeps this duct open during pregnancy. After pregnancy, it closes. Sometimes that prostaglandin remains and keeps the duct open. So what does indomethacin do? It stops the prostaglandin from being secreted. And when that happens, the duct closes. And then you don't need surgery. What is the greatest risk factor for a newborn receiving a cardiac catheterization? You know, I've said once you suspect congenital cardiac issues with an infant, and we do an echocardiogram and we see something, prepare that infant for a cardiac catheterization. And our biggest risk factor, hemorrhage. We're putting a big catheter in the femoral artery and sometimes also the femoral vein to be able to look at where is that defect. And our biggest concern is bleeding, hemorrhage. They can bleed really quick through those huge holes. A 10-month-old status post VSD repair is receiving morning meds. What med should the nurse question? Blood pressure 118/70, temp 99, heart rate 88, respiratory rate 22, 10-month-old. A 10-month-old should have a heart rate at least 130. We know that they're born at 140 to 160 and slowly it goes down, but a heart rate of pulse of 88 is way too low. So what are we going to do? We're going to hold the digoxin, call the physician, and we're going to do a level. While assessing a newborn infant, you notice decreased femoral pulses bilaterally. What would you do next? What are you suspecting is going on? Brand new newborn infant. Doing your initial assessment, those femoral pulses are really decreased. We're going to do a 4-extremity blood pressure. Remember, coarctation is the femoral artery. There's a kink. So decreased blood is going down to the lower extremities. So if we're seeing decreased pulses, do a blood pressure, and what will you see? Well, there's decreased blood flow going down. So they say 20 millimeters of mercury decreased on the lower, and then the upper are going to be higher, 20 millimeters, because the blood is all going up. In older children, that's when you see the headache. Blood flow is going up to the head, not down below. And you also, with these children, might see nosebleeds, all that extra blood flowing up there. How do you get an adolescent to open up about their sexual history? What if this adolescent comes in and this is the third time you've seen him for urinary tract infections? And number one, start talking about, oh, I see that you're wearing Nike sneakers. Those are the new ones. Or, oh, you're listening to music. What's going on? You start talking about that stuff there and get the parents out of the room. They're going to talk to you more. Now you're non-threatening. A multi-select. When educating adolescents about risk for HIV and hepatitis, what would you include? So when you're talking about basically sexually transmitted diseases, which is part of this, abstinence we would like to talk about. Doesn't mean they're going to do it, but condoms, making sure they wear it. And then of course, hand washing always. Weekly showers, well, I would hope an adolescent showers more than once a week. What stage of Erickson's would you use for a school-age child? So they like to do things and do it well, and they're proud of it. Whether it's math, whether it's sports, it doesn't matter. They like to do it well. But school-age children want to do everything well. And when they can't, That's the feeling of inferiority. So industry is the task they master. Inferiority is what they can't. You can't do everything well. A multi-select. A child with hemophilia has fallen. The knee is swollen and painful. Treatment would include what? Remember, our goal with hemophilia and all of this bleeding in the joints is to protect them so that they are not crippled as they get older. So what do? Well, we do that rice thing, whether it's ice is what we need to do because it constricts the blood vessels, so less flow. We're going to elevate it. We're never going to put hot packs. That's going to dilate it and put more flow going on. And we may need to do some of that home treatment for hemophilia, giving them a factor at home if we have that bruise there. Your child with ALL leukemia has recent lab results with platelet counts of 10,000. Nursing action, what would you do for that child? You have acute lymphocytic leukemia. Their platelet counts are 10,000. I don't care who has it, but platelet counts of 10,000, what does that mean? What would you see? What would you be careful of? And that's all about bleeding, right? Platelets low has to do with bleeding. What are bleeding precautions? No IM injections. We will watch everything for bleeding, soft toothbrushes. So, and watching stool and urine. So bleeding precautions are very, very important for these children. Child starts with a nosebleed for no reason. What action should you do? How do you treat nosebleeds? So first thing we're going to do, pinch the nose for 10 minutes. We'll lean that child forward so they're not going to be swallowing that blood back into their throat and their stomach because then they'll vomit. If after 10 minutes they still continue to bleed, they need to go for further medical assistance. An 8-year-old semi-conscious boy is brought to the emergency room. Blood sugar is greater than 600, potassium's up, pH is low, bicarb is low. Priority action for this child. What is that? What are those symptoms telling you? We're telling you this child's in diabetic ketoacidosis. How do I know that? Blood sugar is up, but not only the blood sugar is up, the pH is acidotic. 734 to 7444, 45. That's normal. But when we're seeing 712, we're acidotic. So action, we want to give fluids immediately and start regular insulin drip very, very slowly and monitor blood sugars. And then we'll get those labs and then we'll deal with if the potassium is high or low. We'll take care of that. Child is admitted with hypoparathyroidism. What findings would you see that need to be reported to the healthcare provider? What does a parathyroid regulate? What is that all about? So the parathyroid's all about regulating calcium, okay? As I've told you before, calcium, magnesium, whenever you see those electrolytes, think of muscles because it helps them constrict. And if we don't have enough, what do we see? You're going to see that weakness. You're going to see them shuffling and falling over. Their muscles aren't working. So muscle weakness, hypoparathyroidism, we need to report. Why? They probably need some calcium. A child with small respirations due to DKA. The increased respiratory rate is trying to compensate for what acid-base alteration? Well, what do you see with Kussmaul respiration? It's diabetic ketoacidosis. So how does the respiratory rate try to compensate? What does it do? So Kussmauls are those slow respirations. And it's actually respiratory alkalosis it's trying to do. It is trying to slow down and try to maintain some acid. So it causes the alkalosis. But DKA is acidosis, metabolic acidosis with DKA. Again, make sure you look at your acid base before you go into your HESI. When talking with an adolescent regarding personal health concerns, which is most important? So we've gone in, we've talked about social things, got their confidence, and they're starting to talk with you. And the most important thing is trying to let them express their feelings openly and honestly. So then we really know the big picture of what's going on and why they have urinary tract infections, or why, the other thing they've come to the emergency room or doctor's office. So give them that ability to be able to talk about what they really are feeling. What procedure is priority to keep the lungs of a child with cystic fibrosis open? Remember, cystic fibrosis attacks the small intestines and absorption of food, and it also clogs the lungs with mucus. So aggressive chest physiotherapy is important so that we can oxygenate, right? Oxygen is needed. In the school age conflict, industry versus inferiority, what does industry mean? So that industry means I can do something really well. That is mastering a task, whether hit the ball farthest or spell better or do math better. That is our industry. The inferiority is what they can't do well. And it causes stress for them because school-age children want to do everything well. They want to please. Contraindications to administering the varicella vaccine to an adolescent, a toddler, an adult, it doesn't matter. Varicella vaccine, what do you know about it? It is a live vaccine. Contraindication is when you're immunosuppressed, and you become immunosuppressed by taking corticosteroids, okay? Remember that. You're going to see that whether in MedSurg 2 on your NCLEX. It is a question that I'm telling you, you'll see again. Early detection of a hearing impairment is critical. Which one is of primary importance? When you talk about hearing, you always connect it with speech. If a child is speaking garbled or not speaking up to the level they should, have a hearing check. Could be. In helping a child to adapt to a hospitalization experience, the best approach is what? The children don't want to be in a hospital, and it's very stressful. How can we keep that stress level down? And that's put them on a routine like they are at home. Sometimes, if you can, the same food, same bath time, same bedtime, the TV, the same programs. This will help them feel comfortable and less stressed because it's the same. They don't like change, especially your toddlers, cannot stand it, and they will react to that. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? And what happens if they cannot see correctly at 20 feet? What would you do? Well, if they can't see letters or making them, they're wrong, we would call the healthcare provider. Something's going on with their vision. Referrals for cognitive impairment should occur when? So whenever you see a delay in anything and it becomes to the point where you're concerned, those referrals should start early intervention as soon as possible. As I said, children are resilient, but you've got to start that therapies, whatever it is, as soon as you can. How would you encourage a preschooler to be less apprehensive when taking their vital signs? Preschoolers ages 3 to 5. It's my grandson. He's 5. Again, with this, we're just going to let that child feel and touch and play and maybe take your temperature, maybe take your blood pressure, depending on the child. Taking a couple extra minutes will save you hours in the long run. A nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What's important? You have a child, an adolescent with Down syndrome, and you're, talking about sex. Why? They need a well-defined, concrete code of sexual conduct. And the why is because these are those children that are always abused by certain people. They need to know what is a good touch, a bad touch, because they don't know, they don't understand. And they will be abused if they're not taught. So teaching them what is right and wrong and what to do if something happens will protect these children from being abused by people that are not nice. What acid-base balance might you see with a child that's having profuse diarrhea? So diarrhea actually causes metabolic acidosis. And the reason is this: all of those digestive enzymes that the small bowel common duct that secrete into the bowel are full of metabolic components. So if you're getting rid of all of that in diarrhea, what are you left with? Acid. So that's why it's metabolic acidosis. Now, if you're vomiting, you're going to have metabolic alkalosis because the acid is getting lost. A multi-select. An infant is not passed the meconium stool within the first 24 to 36 hours. What would you assess for? This not passing stool is one of the ways that we can determine some diagnoses. And of course, Hirschsprung, that big bulging of the descending colon, there's no nerve. So stool can't get through except maybe a little bit of ribbon. Cystic fibrosis. Maybe you didn't know this child has cystic fibrosis. We'll test for that with a sweat test. And then of course, hypothyroidism is a third thing. These are 3 things that we can detect just by seeing there's no stools on a newborn. A child with sickle cell disease would likely exhibit what sign? So absolutely it's pain. I mean, along with it, they're usually dehydrated, they're tachycardic, but the one thing they're going to say, I have pain in some, usually leg or knee or abdomen, chest, we've seen it too. How do we treat sickle cell disease? Number one, fluid, dilate those vessels, let those sickled cells get through. And with that, giving them those fluids, of course, we're going to give pain medicine, but priority is fluids. When teaching the child and family about celiac disease, which one of these food items is allowed? So wheat, rye, barley, they can't, but they can have rice, okay? And they can have dairy, and they can have meats, and fruits and vegetables. So there's a lot of things they can have. Just be really careful of all those breaded stuff that we have, and no macaroni and cheese. A 6-year-old goes to the ER complaining of abdominal pain, fever, and vomiting for the last day. What assessment's priority? What are you going to ask first? 6-year-old, they can talk to you, they can tell you. Abdominal pain, fever, vomiting. What do you want to know first? Where is that abdominal pain? I mean, it's an appendix. You can tell things quick. What's an emergency, surgical emergency? And we want to know that first of all. A multi-select. Signs and symptom of hypertrophic pyloric stenosis. So number one is that big profuse vomiting across the room, like The Exorcist, that old movie. But you're going to feel that sphincter is going to be thickened and muscular. And it does. It feels exactly like a little olive right in the mid upper abdomen. Poor appetite. Oh no, they're hungry. They're not getting nutrition. They want more, more, more. And diarrhea has nothing to do with pyloric. A multi-select. A child with CKD, chronic kidney disease, has renal osteodystrophy. What outcomes would you see? What is osteodystrophy? Let's pull that word apart. Osteo, bone. Dystrophy means something's wrong. So you're going to see now, bones has a lot to do with vitamin D. So vitamin D is going to be low. Those bones aren't going to be growing right. It could even be a little crooked. And that pain is going to be there with chronic kidney disease, osteodystrophy. You suspect an infant has cryptorchidism. How would you examine that infant? So cryptorchidism and males and testicles, if it's cold, the sac just sucks up into the body. So you're not going to get a great exam because we're looking for the testicles. So put them in a warm room. They hang, they distend, and you can feel those testicles so much better. Very good. A multi-select. When teaching, would you give parents on how a hypospadias is corrected? So children born with a hypospadias, their urine, your urethra, instead of coming out the tip of the penis, comes underneath. Hypospadias is the one underneath. And we need to correct that before they're potty trained. So what do? And this is really, really important to those Jewish parents because they like to do a bris right after birth, right? They cannot remove that foreskin. They need that to be able to cover that, do a plastic procedure. Now, because they need to create a new opening, a hole all the way to the end, they're going to put a little stent, a little tube. And actually, it looks like those female straight catheters that we use to get a specimen, those long, thin, more not as soft. And they put it in there. And what that does, it keeps that opening open. How do we treat that little stent? Well, all we do is put it inside a diaper. So we make sure that urine doesn't go everywhere. We don't flush it. We don't touch it. We don't manipulate it. We just make sure that it's inside a diaper so you don't get urine everywhere. That's all we do. And these children do really well. A multi-select. Children with nephrotic syndrome are often given albumin and Lasix for fluid overload. What outcome do you want? Remember, nephrotic syndrome has nothing to do with renal failure. Nothing. It has to do with the kidneys saying, protein, I don't know what to do with you, so let me lose you. So it's protein loss like crazy. So we get a lot of swelling interstitially. All the fluid goes everywhere. So you have edema everywhere. So when we talk about protein, it's the same thing as albumin. So we replace that albumin or protein, okay, in, and it pulls that fluid out of the tissue, and then the Lasix is a diuretic and it flushes it. So what do we see? You should have an increase in urine output. It's pulling out all of that fluid interstitially, and it causes a reduction in edema. And with that, it also causes a decreased blood pressure. A 2-year-old goes to the ER with inconsolable crying, abdominal pain. What findings show you this is a medical emergency? What do you think that is? A 2-year-old crying and painful abdominal pain. Probably their legs are going up and down, their abdomens are tense. What do you go looking for? This sort of looks like an intussusception, that abdominal pain, crying, inconsolable, because their intestines have come into each other. So what is the one symptom that we see? What assessment? Current jelly stools. And the other ones, no, current jelly stools, because a little bit of that stool contents go into the diaper or even into, the diaper. And that's what you would see. And that's the thing that we look at and go, okay, let's do an ultrasound, probably intussusception. When assessing a 2-month-old with vomiting, what questions should you ask the parents? 2-month-old infant is vomiting. Parents bring him to the ER or to doctor's office. And the most important question is, does it dribble or does it forcefully come out? Because there's GERD and there's also pyloric stenosis, right? So which one is it? And that will tell you how to treat this child. You notice a 2-year-old with congenital heart disease, their heart rate is decreasing. What other information is important to tell the healthcare provider? Congenital heart disease, that heart rate is going down. So if you're starting to see a 2-year-old heart rate's decreasing. They're not doing the cardiac output the way they should. So that blood pressure is extremely important. The rest of the stuff is basically normal, but that blood pressure on a 2-year-old is too low. I'll multi-select. When entering the room of a child, the child becomes stiff, the arm and legs start shaking. Priority action. What does a nurse do? What do you suspect? So I'm suspecting a seizure is going on here. So I'm going to call the response team in case I need help, okay? Turn them to the side in case they vomit. And then we're going to monitor the time, duration, what does it look like? Never have the parents leave the room. Keep them with their child, because if it happens at home, they need to know what to do. A 3-year-old with waddling gait and falling is admitted for testing. What examination would you anticipate? 3-year-old is waddling and falling. That means muscles in the lower extremity aren't working well. 3-year-old, remember, ages 3 to 7 boys, Duchenne muscular dystrophy. I'm going to get them ready for probably an electromyography, an EMG, and that's going to tell me, you know, if it is problems with the muscles in that exam. Remember, it is uncomfortable. A mother calls the clinic about her child. She's playing in the woods and has a rash that is spreading. What over-the-counter medication is good? She wants to know what to give her child. She was out playing in the woods and now has a rash, but it's starting to go everywhere. Well, we don't know if it's just mosquitoes or ticks. We don't know. So if it's spreading, maybe it's an anaphylactic reaction. So we're going to take that kid and get medical treatment. 3 more. Mother calls the clinic. A friend of her child has ticks from playing in the field. What do you tell the mom to do? So her mom's child's friend has ticks. What do you want that mother to do?
Oh, quit.
So if the friend has ticks, you need to check her for ticks. It means get her naked, look head to toe for sure. An adolescent goes to school, a nurse complaining of ringing in her ears. What exam should you do first? I mean, any child. It's ringing in the ears. What do you do first? What assessment?
Hurry up.
So first thing we're going to do is let's look at the ear. Maybe there's something in there. Maybe there's a earwax, something's going on. So first, let's do the inspection, and then we go further after that.
Mama, just can I tell you something? Oh.
Last question. An infant is being DC'd after 14 days of vancomycin. What teaching should be included? Well, what is vancomycin? It's an aminoglycoside. What do we worry about aminoglycosides? We know we do peaks when we do troughs. And why? Give me 2 minutes. So it has to do with the side effects of hearing and urine. So yes, we are going to monitor their hearing and also look at their diapers, making sure their kidneys were not damaged. Here we go.
Look at you.
Number 3, Lauren. Good job, Lauren. Number 2, Kanisha. Number 1, Nikki. Good job, guys. Number 4, Jess and Ulysses. So that is your HESI review. I think it really shows you the variety. You could see some questions from before. So anybody who wants to go over it with me alone, not a problem, but I think you guys did great. So thank you, everybody, and I wish you all the best. And I hope that I will see you for the HESI review on Friday. Some of the questions are similar, asked a little differently. So thank you, everybody.
Thank you.
My pleasure.